Below are 50 MCQs on the musculoskeletal system with answers and one-sentence explanations. Number 50 MCQs, the musculoskeletal system. 1. The anatomical position includes all except A. Standing erect, B. Palms facing forward, C. Feet together, D. Arms raised above head, answer D. Explanation. In anatomical position, arms rest at sides with palms forward. 2. Which plane divides the body into left and right halves? A. Transverse, B. Frontal, C. Sagittal, D. Coronal, answer C. Explanation. The sagittal plane separates the body into left and right sections. The axial skeleton includes all except A. Skull, B. Vertebral column, C. Ribs, D. Pelvic girdle, answer D. Explanation. The pelvic girdle belongs to the appendicular skeleton. 4. The appendicular skeleton consists primarily of A. Skull and vertebrae, limbs and girdles, C. Ribs and sternum, D. Hyoid bone. Answer. Explanation. Appendicular skeleton includes upper lower limbs and their girdles. #5. The main function of long bones is A. Protection, B. Support and movement, C. Sound transmission, D. Blood filtration. Answer B. Explanation. Long bones act as levers for movement. 6. The diaphysis of a long bone is the A. End part, B. Shaft, C. Outer covering, D. Growth plate. Answer. Explanation. Diaphysis refers to the long shaft of a bone. #7. Compact bone is primarily located in the A. Epiphysis, B. Medullary cavity, C. Diaphysis, D. Articular cartilage, answer C. Explanation. The diaphysis is composed predominantly of compact bone. 8. Spongy bone contains A. Haversian canals, B. Yellow marrow, C. Trabeculae, D. Periosteum. Explanation. Trabeculae are lattice-like structures found in spongy bone. 9. Bone growth and length occurs at the A. Periosteum, B. Endosteum, epiphyseal plate, articular cartilage. Explanation. The epiphyseal plate enables longitudinal bone growth. 10. During ossification, cartilage is replaced by A. Blood, B. Muscle, C. Bone, D. Dense tissue, answer C. Explanation. Ossification converts cartilage into bone tissue. 11. Intramembranous ossification forms A. Long bones, B. Flat bones, C. Irregular bones, D. Short bones. Explanation. Flat bones such as the skull form through intramembranous ossification. 12. The skull bone primarily classified as flat is the A. Mandible, B. Femur, C. Frontal bone, D. Humerus, answer C. The frontal bone is a flat bone protecting the brain. 13. The functional unit of compact bone is the A. Lacuna, B. Osteon, C. Canaliculus, D. Trabecula. Answer B. Explanation. Osteons' Haversian systems are cylindrical units of compact bone. 14. Osteoclasts are responsible for A. Bone formation, B. Bone resorption, C. Cartilage growth, D. Collagen production. Answer B. Explanation. Osteoclasts break down bone tissue. 15. The vertebral column contains how many cervical vertebrae? A5, B7, C12, D14. Answer B. There are 7 cervical vertebrae. 16. The sternum consists of all except A. Manubrium, B. Body, C. Xiphoid process, D. Acromion. Answer D. Explanation. The acromion is part of the scapula. The scapula is part of which girdle? A. Pelvic, B. Pectoral, C. Vertebral, D. Axial, answer B. Explanation. The scapula forms part of the pectoral shoulder girdle. 18. The pelvis includes which bone? A. Sacrum, B. Clavicle, C. Ulna, D. Fibula. Answer A. Explanation. The sacrum helps form the pelvic ring. 19. The largest bone in the body is the A. Tibia, B. Femur, C. Humerus, D. Ilium, answer B. Explanation. The femur is the longest and strongest bone. 20. A joint with free movement is classified as A. Synarthrosis, B. Amphiarthrosis, C. Diarthrosis, D. Gomphosis, answer C. Explanation. Diarthrosis joints, synovial joints, allow wide movement. 21. The knee joint is an example of A. Ball and socket joint, B. Hinge joint, C. Pivot joint, D. Saddle joint. Explanation. The knee primarily allows flexion and extension like a hinge. Line 22. The hip joint is A. Hinge joint, B. Pivot joint, C. Ball and socket joint, D. Gliding joint. Explanation. The hip is a classic ball and socket joint for multidirectional movement. 23. The atlas, C1, articulates with which skull bone? A. Temporal, B. Occipital, C. Parietal, D. Frontal. Answer B. Explanation. The atlas articulates with the occipital condyles. 24. The structural classification of joints includes A. Synovial, B. Tendinous, C. Vascular, D. Musser, A. Explanation. Structural classification includes fibrous, cartilaginous, and synovial. The shoulder joint allows the greatest range of motion because it is A. Deep and stable, B. Shallow and flexible, C. Rigid, D. Non-synovial. Answer, explanation. Its shallow socket allows extensive mobility. Articular cartilage is composed of A. Elastic cartilage, B. Hyaline cartilage, C. Fibrocartilage, D. Dense connective tissue. Answer B. Explanation. Hyaline cartilage covers bone ends and synovial joints. 27. Synovial fluid is produced by the A. Joint capsule, B. Synovial membrane, C. Ligaments, D. Meniscus. Explanation. The synovial membrane secretes synovial fluid. 28. The menisci of the knee are made of A. Elastic cartilage, B. Fibrocartilage, C. Hyaline cartilage, D. Bone. Explanation. Menisci consist of tough fibrocartilage. 29. A fracture that pierces the skin is called A. Closed, B. Green stick, C. Compound, D. Impacted. Explanation. Compound fractures involve bone protruding through skin. 30. Osteoporosis mainly involves a reduction in A. Bone collagen, B. Bone mineral density, C. Synovial fluid, D. Muscle mass. Answer B. Explanation. Osteoporosis results from decreased mineral density. 31. The clavicle articulates with the sternum at the A. Xiphoid joint, B. Sternoclavicular joint, C. Costosternal joint, D. Acromioclavicular joint. Answer B. Explanation. The sternoclavicular joint links clavicle to sternum. 32. The radius primarily rotates around the A. Ulna, B. Femur, C. Humerus, D. Patella. Answer. Explanation. The radius pivots around the ulna in pronation supination. 33. The tibia is located A. in the arm, B. in the thigh, C. in the lower leg, D. in the foot. Explanation. The tibia forms the medial lower leg. 34. The main function of red bone marrow is A. Energy storage, B. Blood cell production, C. Calcium storage, D. Fat storage. Answer B. Explanation. Red marrow is responsible for hematopoiesis. 35. The periosteum contains A. Nerves and blood vessels, B. Only cartilage, C. Red marrow only osteons. Answer A. Explanation. The periosteum nerves and vessels. 36. Tendons connect bone to bone, B. Bone to muscle, C. Muscle to muscle, D. Ligament to bone. Answer B. Explanation. Tendons attach muscles to bones. 37. Ligaments connect A. Muscle to muscle, B. Muscle to bone, C. Bone to bone, D. Bone to tendon. Answer C. Explanation. Ligaments stabilize joints by connecting bones. 38. The temporal bone houses the A. Olfactory bulb, B. Auditory structure, C. Optic nerve, D. Pituitary gland. Answer B. Explanation. The temporal bone includes the structures of the ear. 39. Scoliosis refers to abnormal curvature in the A. Sagittal plane, B. Frontal plane, C. Transverse plane, D. Oblique plane. Answer B. Explanation. Scoliosis is a lateral side-to-side curvature. 40. The acetabulum is part of the A. Scapula, B. Hip bone, C. Humerus, D. Patella. Explanation. The acetabulum is the hip socket for the femur. 41. A synarthrosis joint is A. Immovable, B. Slightly movable, C. Freely movable, D. Synovial. Answer A. Explanation. Synarthrosis joints allow no movement. The mandible is unique because it is A. The only sesamoid bone, B. The only movable skull bone, C. The only flat skull bone, D. Completely cartilaginous. Answer B. Explanation. The mandible is the only freely movable cranial bone. 43. Calcium is important for bones because it A. Stores oxygen, B. Increases flexibility, C. Provides mineral strength, D. Prevents infection. Explanation. Calcium contributes to bone hardness and strength. 44. A nursing implication for immobility includes monitoring for A. Joint hypermobility, B. Pressure injuries, C. Increased muscle tone, D. Bone overgrowth. Explanation. Immobility increases the risk of pressure ulcers. Range of motion exercises help prevent A. Bone fractures, B. Joint stiffness, C. Rapid bone growth, D. Skin breakdown only. Answer B. Explanation. Roam exercises maintain joint flexibility. 46. When lifting a patient, nurses should A. Bend at the waist, B. Keep load close to body, C. Twist the spine, D. Use back muscles primarily. Answer B. Explanation. Keeping weight close reduces spinal strain. 47. A green stick fracture is most common in A. Elderly adults, B. Young children, C. Athletes, D. Pregnant women. Answer B. Explanation. Children's bones bend and partially break in green stick fractures. 40. Humerus articulates distally with the A. Radius and ulna, B. Scapula, C. Clavicle, ribs. Answer A. Explanation. The humerus forms the elbow joint with the radius and ulna. 49. The patella is classified as A. Long bone, B. Irregular bone, C. Sesamoid bone, D. Short bone. Answer C. Explanation. The patella is the largest sesamoid bone. 50. A primary nursing concern for a patient in a cast includes monitoring for A. Increased appetite, B. Circulatory impairment, C. Improved flexibility, D. Bone overgrowth. Answer B. Explanation. Casts may impair blood flow, requiring neurovascular checks. Thank you. Have a nice day.